Dear brothers and sisters in Christ, it is my privilege and pleasure to be with you all for this 1 hour session on the medical aspects of the crucifixion and resurrection of Christ. So many doctors, so many Christian doctors are there, but only few have contributed into this line. God had given me the opportunity to think about this topic 10 years back to one TV channel in Tamil Nadu, where I gave a 1 hour presentation on the crucifixion of Christ. Subsequently, I was searching through so many literatures and thinking about the topic. And last year also, by God's grace, we had this session. And I had the passion and God's guidance to write into a book which will contribute to the Christendom to understand about this crucifixion, resurrection. Another 10-20 minutes maximum. Let me present my slide now. Hope you're all seeing my presentation, right? PPT?
Yes.
Dear brothers and sisters?
Yes. Yeah.
Thank you, brother. Today our topic is the medical aspects of the crucifixion and resurrection of Christ. Last year, same time also, we had this session. That time the topic was only about the crucifixion. For this year, we have added the another title as the resurrection. So I have more to talk on the title actually. And you know that from this 1 year, I told that I had the proposal to write this a book. So I have a lot of information, but with the limited time, I'll just give only an important gist of the crucifixion and resurrection account, especially in the medical aspects, so that we will come to know not only the historical sequence and also the medical aspects to understand the passion, the sufferings of Christ, and the aspects involved in the resurrection. Through that, not only to gain our knowledge, but to have conviction, so that we will be able to equip ourselves to answer to the queries raised by the skeptics. This is not only for the knowledge aspects, but it is my expectation, prayerful expectation, that at the end of the session, what it is meant to me personally, that you have to think. With that, I have to finish. That's what my objective of this presentation. As I told you, I went through many literature. That literature all covering are more of these kind of sources, like obviously biblical accounts, talking about all the 4 gospels. Not only that, Old Testament prophecies in the New Testament, how it was fulfilled, even after the crucifixion and resurrection of Christ, what happened in the new first century, all the records are in the biblical accounts. But that is enough only for those who believe. But for others, those who believe only when there is a history says, for that only those who believe that there is archaeological evidence says. For that also so many evidences are there. We have gone through that, and I'll be presenting that one also. The historical evidences in the Roman historians in the first century itself, that Tacitus, Pliny, and Suetonius, and the Jewish scholars like Josephus, Talmud, and also the archaeological evidences like Shroud of Turin and the first century skeptical remains. These are all confirming to the evidence of the crucifixion of Christ as a historical and proved evidence, which gives more confidence to our proud to our faith. So we'll go to the first sequential accounts. As I told you, the time is very limited. I will go through only the important aspects, and in the discussion parts, anything what I left or to be need discussion, we can go there. Sequential account, we know that where the crucifixion starts and where it ends, it's a long history. This is because it was foretold in the Old Testament, and Jesus came for that only. There itself, everything starts. So actually, we can't really say that where exactly these evidences, these incidents starts. But to be specific, as we talk about the 3 days of events, Friday, Saturday, Sunday, that 3 days events, we can put it in this title as Thursday night into the Friday early morning. What is happening? What is happening in the Gethsemane? After the Passover night, Passover, this one, Jesus went to Mount Olive, and there he was going for prayer. Disciples were there, but they were sleeping. but he was with agony of what he's going to face within a day, within hours, within minutes. He was praying, and one point of time he finished that prayer. That happened for 3 hours, approximately from 9 p.m. to 12 midnight. Then after that, what happened? He was arrested by the temple officials, and he was put into the trials by two aspects, that the Jewish trials and the Roman trials. Jewish trials mainly that religious aspects, Roman trials basically the political aspects. So first he is going for the Anna, the high priest. Then he is tried before Caiaphas and the political Sanhedrin between 1 a.m. to before the dark break, and he was convicted of blasphemy. What is the blasphemy? He told himself that he will be a king, so it is a blasphemy. It is against the ruler, king. So then comes the third trial with the religious Sanhedrin. After that, Friday morning, these are the things happening. First, he appears before the Pilate, and he was the Roman procurator, and he sent to Herod Antipas. But again, he was sent back to Pilate, and finally, he was put into sentence without conviction, but without the full mind, or without having the evidence. Due to the compulsion, Pilate offered Jesus to sentence Jesus to go for scourging and crucifixion. So these all happening by Friday. So many incidents: scourging, mockery. Then comes then he is taken to Kolkata for where this crucifixion where and there he is put on nailing, and around 9 a.m. to noon, that time this nailing, the things are happening. So basically he was there in the cross for 3 hours, roughly from 9 a.m. to until 3 p.m. when it was confirmed that he died. You all know that he died. That was confirmed by that spear wound, which brought out blood and water. That's a confirmation of the death. Because of that, subsequently he was not crucifixed, which normally end that crucifixion, the person to go for death at that time itself. That was not happening in Jesus' death. Okay, we'll come to then what happens after his death. He is buried. Sorry, that burial formalities are happening. Joseph of Arimathea, member of the Sanhedrin, requesting the body. The body of Jesus is wrapped in linen and placed in a new rock-cut tomb. So then the tomb itself been sealed with stone, and God is being kept. Then finally we know what happened. He resurrected and he appeared. This resurrection happened the early Sunday morning. People discovered, those who went there the early morning, they discovered there was an empty stomach, empty tomb. Then comes the incidents that post-resurrection appearances. Then he ascended to heaven to Father after 40 days. Now we are going to consider two important scenes, as I told you the title itself: crucifixion and also resurrection. So crucifixion, so many incidents, historical incidents. I told you what happened. Now I am putting them into in the following titles, so that we'll understand the medical aspects of that crucifixion, and we'll understand the agony he faced. So this is the scene from where he went to where. So I put into 8 titles here, that what is happening in the Gethsemane. In the Gethsemane, he was praying. There he was praying with a burden that he is going to face death. He was not afraid of death. He was not having that sorrow because of that. He is going to face death. In that, he is going to carry the whole burden of the sin of the whole humankind. So that was the mental agony he has really. And physical before the physical crucifixion, he had the extreme mental anguish. Because of the exit mental anguish, it is told that the blood came out as a sweat. That in medical term it is called that hematidrosis or hemohydrosis. This is, though it is a rare incident, this happened in Jesus' time. That we can be sure that there were few evidences that happened that time itself. And Second World War also, there is two obvious evidences that this happened to the people when they faced sudden agony of facing death. This is for your understanding. You all know that when the normal person or the person having blood pressure treatment suddenly having some psychological or stress or something, his BP goes up, and what happens? Nose from bleeding, epistaxis, and the bleeding in the vessels in the brain. One side that is happening, the stroke to the opposite side, or that is for by the clot. But if it is an extension, so that can cause the stroke, severe cases, both side also. So this obviously we understand that when there is a stress or uncontrolled hypertension, this happens. Here comes, because of the acute mental anguish, this hematidrosis or hemohydrosis that incident is happening, where the capillaries, the small blood vessels near in the surface, under surface of the skin, subcutaneous, that area, from each that point where the sweat gland, where that hair is coming out, that area, the blood is actually coming out. So that is the scene. Because of that, what happens? Because of that, every tiny part of that opening filled with blood, because of that swelling and this thing, that skin will be more painful and it will be fragile. So that's what the scenes we are going to see. What happened the next this thing? Physical beatings are happening. Physical beating, it is not by the just beating. For the beating, that flagrum, there's a wound handle and there's a leather tongs are there. At the end, small bones, small metal balls are there. This shows the severity of this one, how he faced this scourging, these beatings. And here comes the direction of this one. Usually there will be two persons in the either side, and the person, it is been beaten in the back, and those who are sitting in the left side of that person, he will be puncturing the area of the right side. So the person standing in the right side of the person who has been crucified, that he will be making punctures of the left side. So this is the directions it is mentioned here. From this we can assume that it is not beating from the same side. Beating the same side is a small kind of injury, but standing from one side and making the wounds in the other end means that is making that towards the body, so that will be more vulgarous. And here, what is that blasphemy? He told that he will be a king. So Roman emperors, Roman soldiers, with their affection for that country and for the king, more aggressively they were doing these scourgings. So we can understand that. So because of that, what is happening? Repeated and very dangerous beatings are there. Because of that, there will be lacerations, contusions, even bearing the skeletal muscles. Because of that, there will be a reasonable, appreciable blood loss and also the hypovolemic shock. That means because of the body, that not only the exertion, not only the sweating, this blood also oozing out from the wound, and that is bringing out the hypovolemic shock. That actually one of the contributing factor for the cause of death of Jesus. And crown of thorn also here happening. That is from a herb. they are keeping in that head of the Jesus, it is not usually put only in the top of the head of Jesus, as been mentioned or picturized in our pictures. Actually, it is overhead and also the side, so that being pressed, it will be more painful, and also that will cause the damage to the trigeminal nerves and facial nerves in these areas. So that will cause a severe pain. See, just assume someone is injuring some part, or some thorn prick is happening to our body. It will be less pain than something happening when it is to the scalp. Why? Because there only the skin is there, and underlying subcutaneous tissues are very less, and also directly it is over the skull, so it will be more painful. And because of the tight that skin, that area, whatever the blood being collected in that area because of the injury, that will be more painful. So that we can assume how much sufferings he faced for us. Obviously, carrying the cross also one of the suffering he had. That will be horizontal part and the vertical part, both part that we are actually seeing in our pictures. But practically, only that horizontal part, patibulum, only been asked by the person to carry from that initial scourging that area plus to the actual crucifixion area. So that was around 1 kilometer, it is said, but it took a lot of time, maybe some 1 2 hours, 3 hours. But Jesus was not really was able to bear that also. That horizontal will be part will be having some 35 to 56 kilo weights. So that also was really unbearable for Jesus because of all the things happened so far. So Simon was asked to carry. This shows that how much he was at the severe dehydration because of all the factors contributed: lack of sleep, mental agony, sweating, blood loss, because of all these things. Okay, then comes the nailing. Nailing, normally we see the pictures like this. That some pictures will put the people will see that there's a stool, a footstool, so that he can stand like that. And here also some pictures will show that he was pierced in the palm. No, it is not. It was between the space in that wrist actually. The reason, the medical reasons and the explanation, and that we can be confirmed that here means the whole body for hours person was hanging. That body weight it will not bear. It will cut through. And also piercing here, it will break the bones here. But it was a prophecy that none of the bones will be broken for Jesus. And it is a possibility that's a confirmation that his bone was pierced not in the palm, in the middle of palm as it has been in some pictures. It is obviously in the wrist. Why? It was 5 to 7 inches length to carry the whole width of that one. And also when you put that there will be a nerve going, median nerve. One nerve is going, that will be compressed and that will be broken. Because of that, there will be severe pain there. In the same manner, leg also, it is being put in this direction, in this area, so that there will be peroneal and plantar nerves. That damage will happen and that will cause the severe pain. So just assume how much sufferings he really bared over the cross. And suspension of the body, suspension on the cross. What will happen? See this picture. See this picture. As I told you earlier, he did not have the footstool as in some pictures, but there was a practice in that area at that time also, based on the severity and this. But for Jesus, this was the real scene. And in 3 places, he was nailed. For us, it's as we assume for the respiration, we assume that it is coming, going inside, breathe in, breathe out. But you just see when you take a breath in, that chest is that muscles are pulling up and chest is expanded, and leg, in this position that leg has to push, and the hand it has to pull the body to up so that he can inhale, then leaving that he can exhale. Without inhalation and exhalation, there won't be breathing for the circulation for life to continue, right? So this is really difficult in this position for breathing. So based on the severity of the pre-crucifixion scene, how severity was, how severely he was beaten, or how he was tied in the cross, based on that, the person will be hanging in the cross for hours to days or week also. But here this happened in Jesus, this one that, this happened very short in the sense he died in 3 hours. So from 12 to 3, he was saying few words. 7 sayings of Jesus Christ we all know. We will be going to meditate in the next coming Friday, Good Friday. But breathing itself is difficult. How he could have said all these sayings? When someone near to us pass away, we think about the later days events. So in that the same manner, his sayings on cross also very important. But consider this way, not only the saying in there, all the incidents before that over the previous 2 days, not only 2 days, it is prophesied, he born that time itself, why he came, it was told, and the teaching itself, he is telling that what kind of death he is going to face and how he is going to resurrect, everything, that's all happening from the beginning itself. So all these teachings, all the things happen in life, everything to be remembered, that's what we are doing actually. So in Good Friday, meditating these 7 words, actually we have to meditate along with everything happened in his life. So that is obviously been done most of us, but I'm just thinking, telling you, you have to think in that way, then only that will be complete. Okay. And the other aspects, breathing itself is difficult. How he would have told this? He told 7 words. Just go through these words. Father, forgive them, for they don't know what they do. And second, he is telling to one of the thief, today thou shalt be with me in paradise. Then comes, he is telling to his close disciple that behold your mother, and towards mother he is telling, behold thy son. And then he says, my God, why hast thou forsaken me? Then comes, I thirst. Then comes, it's finished. So considering all the lines, his words are shortened, are very short. Assume a patient coming to hospital with the breathing difficulty, asthma, for your understanding. When we ask some questions, they know what is being asked, they can answer, but they can't answer by word because they are more conscious of breathing in and breathing out for the survival. They can't pass and talk to you. So what they will do with the difficulty, whatever the long question you ask, they will put in a one-word answer. But here comes the strong, lengthy, conscious words. It has meaning. It has the purpose. You have to understand the thing from here. But one thing in my assumption, or I assume that over the period of time, that in the 3 hours, his words are coming down. Obviously, because of the suffocation and because of all the problems for breathing in, breathing out, he is not able to tell too many sentences. But comes the last, Father, into thy hands I commit my spirit. This shows, this is actually, with this, he left his spirit and he died. So that's what we see. So in that case, consciously, with full conscience, willingly, he committed his life for us. So that's the thing we have to come from that. Some skeptics say that he drank, he would have taken vinegar, or he would have gone for acidosis, and so unconscious level. They thought he died. So like that, people may think, but consciously he was speaking with a lengthy sentence, and he surrendered his life for us. Okay. That has been confirmed by spear wound. Why this spear wound happened? Because to confirm the scene only. The next scene is going to happen actually, the crucifixion, to cut short the crucifixion, the suffering process, to make that person to die within the day itself, means they have to fracture the tibia or fibula of the leg bone. But it was not done in Jesus' case because he died already. To confirm that, it was spear wound with a spear wound. John is explaining that water and blood and water came out of this wound. So this is the situation there. You can see the person from the right hand side is passing that spear from right side to right side of Jesus to the left side of his body. This is a cut section. Here comes the lungs. Over the lungs, that's a pleura. Then passes the coverings of the heart, that is the pericardium. Then comes right ventricle, that is the heart. So with this direction, obviously it will go through the covering of lungs and also the covering of heart, then comes to the chamber of the heart. So obviously it is told that water and blood. So here this is how this water came. How this water came. When the person having a disease to the lungs like pneumonia or the chronic infection like tuberculosis, they'll be having a pleural effusion, collection of fluid because of the long-standing that disease process. Here also Jesus is going through long suffering. Mental anguish itself caused some bleeding, Here they breathing in, breathing out, hypovolemia, so many incidents are happening, so many acidosis, some baroreceptor mechanisms are happening. So because of that, there will be secretions. Finally, there will be a collection. There will be pleural effusion. That is the first possibility from here. And also from the heart, the blood and water only will be there. It is not the pure blood. Because, see, after coagulation also, after clotting also, some liquid will be there. That's a lymph. So that lymph also would have come from the body. So that it shows that it is not the fresh blood. Some skeptics say that because of the spear wound, it's only all the blood came out and he suddenly died. No. Each moment by moment, minute by minute, he suffered for us and developed these effusions. That is the water. That I strongly believe. And comes, okay. So, cause of that, so many things are being told, but the death of Jesus is a multifactorial. So many factors we can say that dehydration means pain shock, stress-induced arrhythmia, heart failure, because of the effusion, that heart and lungs was further not working. So many things we can say. Finally, crucifixion, but that's what not happening in Jesus' case. So actually, death by crucifixion, that itself is the cause of death we can say. But very specifically, he died by traumatic hemorrhagic shock because of the trauma in the various incidents starting from the crown, then scourging, so many things are happening, and nailing, and he is suspending in the cross for hours, all kind of trauma causing the bleeding, and because of the hemorrhagic shock. That is the main accepted by many researchers. The contributing factors, obviously, the asphyxia due to the inability to breathe in and out, and also because of the bleeding, there will be coagulation disorder, disseminated intravascular coagulation, that condition. All these, finally, what happens from the beginning to the end of the crucifixion scene, only one thing is involved, that is blood. Loss of blood, that is the shedding of blood in the cross. Whole blood for us. He died due to the traumatic hemorrhagic shock. That is the cause of death. Okay, lack of time, will come to the next part. I'll go through very fast. That resurrection. Without that, we won't be talking about this till this 21st century. Because of the resurrection only, we are talking about this one also. So without that, it is not complete. So comes resurrection. So that itself is the foundation of Christianity. This has been told in the last chapters of all the 4 Gospels. I'll tell you a few things about what exactly the resurrection. It will help us to understand how that Jesus' resurrection is different from the other resurrections we assume. See, death resurrection in the old times itself, it was assumed that it is the death reversal. That means the body is getting back the life, so coming back to life. So that was not even be thought about in the myth, not been told in the myth of that age itself. So that is new to them also. And resurrection means there will be the physical embodiment. There should be a physical body. It is not only the spiritual resurrection. It is not assuming. It is not seen by hallucinations by others. Not like that. Not like that. It should have a body. And so that resurrected, that body is a new body, that something different from others who were raised from dead. So that is, we say that the resuscitation. Resuscitation is the term we use in medical field, that patient is about to die, we do some mechanics, first aids and the other medical aids, and finally we bring back to his life. He is coming back to life. How long? Till he faces the next incidents. One day or other he has to die. Less than 100 years. It is been said in the Bible that average how many years? Okay, I'm not going to that time point lack of time, but all they died in one point of time. Even the people raised in the Old Testament, even raised the people raised by Jesus Christ, and even the people raised by the disciples of Jesus in the first century, all were dying again. So that is called resuscitation. But here the actual resurrection, that body which the physical embodiment will not die again. So that is living forever. So that is the actual meaning of the resurrection. That gives the more of further discussions. Like that is actually the significance in Christian, this one, that Paul is saying in 1 Corinthians 15 that if Christ is not read, the preaching is foundationless. Our faith is worthless. We will be still continuing in sin. Like that he is talking. So many arguments he is telling. So that much the resurrection part is more important in Christian faith. And it is a unique claim by Christianity, none other religion. And after the resurrection only, and based on the resurrection account only, so the church developed in that first century. So that is the basic significance and beginning evidences for the resurrection. Okay, I'll be telling few evidences, then I'll close this. Jesus' prediction, he himself predicted about his resurrection. From that we can believe first, because whatever he taught, however was his life, everything was authoritative. Most of the things during his life, what was prophesied, it was fulfilled. So we can assume, we can strongly believe that his prediction about resurrection, so we can believe. He himself told that the sign of Jonah, 3 days. So here also 3 days this happening. So we can strongly believe that he told that on third day he will be raised. So definitely we can believe. But this can be believed only those who believe in Jesus, those who believe in Bible. So comes the next evidence says that some of the certainty of Jesus Christ's death, that is the historical bedrock. So that gives the foundation for our belief or evidence for resurrection. Romans are very expert in performing the crucifixion. Nobody can escape death by their crucifixion. So it is unlikely that Jesus was in a unconscious manner. They assumed that he died. So he was given to people and he got up. No, we can't believe, because they are expert in making sure that that person died. That was going to happen for Jesus also. But Pilate was that astonishing how fast this came, his death. So to cut short his death or to make sure he is dying, they didn't do breaking the legs. So these are all confirming that. And also the other medical confirmation that blood and water from that spear wound. So that all confirming that he actually died. And the scholarly consensus also there. Even the skeptics and the atheists they believe, they accept the evidences that Jesus was actually crucified. So that evidences are there. That gives the evidence that he raised also. So this comes the next evidences that empty tomb. The stone was laid. The stone, it is told that around 1.5 to 2 ton weight. One person can't push away. We need more people, but that is been pushed away and he raised. And Roman seal was put, and God were put that for guarding that this one. But in spite of that, he came out and empty tomb. It was witnessed by many people. So that's the evidence. First evidence is that witnessing of the women. Normally, like nowadays, previously at that time also, that status of woman was not accepted. Means they are not obviously known in the society. But here comes the early witnesses of the empty tomb was by women. So that gives more authenticity or more this one. It is not the story. And multiple attestations saying that not only this one, all the 4 gospels, it has been written. And lack of veneration in the Jesus time itself for the religious leaders or prophets, the tomb, they will be worshipping. They will be performing them some religious this one periodically. But that was not done for Jesus. Why? It was an empty tomb. So, and also after the resurrection also, he appeared to many people. He appeared at least to 12 incidences, it is mentioned, to Mary Magdalene, Peter, James, and 12 others, and 500 believers at a time. So like that, so many, this one. And there was a physical interaction. It was not just seen by others. He was talking to them. He was heard by them. He was touched by one of the disciples. And they watched him eating food. So these are all the evidences. And transformed enemies. Even the first century skeptics, like James, it is said in the history that skeptic James and Paul, the Saul, kind of enemies also, they were transformed just because of these appearances. And these are also evidence showing that so many transformed lives. The cowardy disciples became their strong witnesses. They also faced this kind of death in the coming days. So this all shows that this is the evidence. And the people worshipping on that day, on Saturdays, Sabbath, that worship changed into Sunday. So that means a total sociological transformation, that church became to existence and worshipping on Sundays. So this is evidence, the psychological and also the sociological evidences. Still people, skeptics put some theory saying that he was actually, he didn't die actually, he was in a conscious, this one, he was taken away. And some people say that it was theft, they took out the body. And people say that, some people say that it is only the hallucination. But the hallucination happened for 40 days. That is not in the history. And hallucination can't happen for 40 days. So these are all the things that, evidence that he raised. And wrong tomb theory, people are telling, but obviously the person, Joseph of Arimathea, is there. He would have been incurred to verify the tomb. So, and it shows that there is the empty tomb. So, and also he is raised. So we'll come to the conclusion. He is risen, and he is risen indeed. It is not only by those who believe on Jesus or Bible, those who go through the evidence of history, archaeology, and all other evidences. And Bible says in Isaiah 53:5, he was pierced for our transgressions, he was crushed for our iniquities. The punishment that brought us peace was upon him, and by his wounds we are healed. Dear brothers and sisters, we have to think about this for our own personal application today. We saw all this story of his crucifixion and resurrection. That is the story of Jesus. That is history. But when we accept that he was pierced for my transgression, he was crushed for my iniquities, the punishment that brought for me to peace upon, so this, by his wound I am healed. When we believe on that, there comes the my story, that is mystery, that is salvation. Dear brothers and sisters, this program is not for our gaining our knowledge. This is for our experience. This is not just his story. This has to become my story, our story, that is mystery, the salvation. Do we have that personal salvation experience? It is good. If not, ask for that. He has the same power to save us, save you and me from our other sins. And so many people are longing for evidences and knowledge for them. Are we going to give only the knowledge? No, they have to have a salvation experience. How we are going to make it real? I told you somewhere that that transformed life in the 1st century was the evidence. But see the present, current 21st century Christendom, we all responsible for bringing back that transformed life in front of others, so that we'll be the witness for his resurrection. Are we ready? I will stop here. Now the time for discussion.
Thank you very much, Dr. Pethuru, for your enlightening speech. It was really an eye-opening for many of us. The floor is open for anyone who is willing to ask questions. Any clarifications, kindly come up and unmute yourself and ask questions, please. Doctor, I will start with my question.
Yes,
so people would be able to ask freely after that. Doctor, there are skeptics who say that extreme torture and things like this, could it have been he could have gone into an induced coma, because skeptics say that there was no confirmation of death like modern medicine. Modern medicine, we have so many standards for confirming death. Then they didn't have. So medically, how would we respond to skeptics like these who ask questions? Because there were no standards of confirming death those days. Maybe he was in coma. So how could we explain to the medically, doctor?
Yeah, medically skeptics, as I told you in few points, that they are telling that he would have died of many things, like he didn't die at all, like he was in the coma stage and was brought down. So that is no death at all. That is, they are telling. And some people say that it is because of, he was actually not having much torture and all, he was comfortable only because of the spear wound, that is a fatal injury, directly hit to the heart, blood came out, so that is why he died. So it is nothing to big like that. Some theory people are telling that is kind of sudden death like that. And some people will say that because of the suffocation, that respiratory acidosis, some chemical for this one, because of that he went to coma and he died. So that also been told. And some people say that because of all this, during this process, like exertion for breathing in, breathing out, this one, that cardiac rupture, that can happen, cardiac failure. So heart actually didn't press like that. And some people say that pulmonary embolism, he was talking normally only, suddenly one blood clot came from that lungs, that area, and went to brain, because that kind of pulmonary embolism will cause this kind of sudden coma and death, like that. So like that people are telling, but actually not. That can be, all these theories are being explained by medically, that all can be contributing in one or other way. But mostly accepted, the historians and the evidences say that he died of traumatic hypovolemic shock, hemorrhagic shock. There was no further blood. All the blood were shed. And because of that, only water and blood came, even in the final account. That's the evidence that he died with long process.
Thank you, doctor. Thank you. The floor is open for others to ask questions. We are running out of time, so kindly hurry up and ask your questions, please. Doctor, nowadays we have these death confirmation techniques and all. I do not know the proper terminology. Anniki, those days, did they have any kind of confirmation, death confirmation, ancient days? How did they confirm anything like that medically?
See, here in medical, death itself is physical death. Means before that, brain death. Brain can survive for years. Brain can die and body can survive for years. That in the recent news also we come across. So to confirmation in the this one, death itself, so many various aspects. For that we say that no pulse, no breathing for 15 minutes or at least, or 15 to 30 minutes of 30 minutes of resuscitation. We couldn't recover pulse, heartbeat, that is heartbeat, and respiration means we confirm that it is death. So this is the kind of death now itself. This is a kind of death. So old days, not much records about that. Maybe they would have waited for some hours.
Okay.
But according to the record, it is said that crucifixion is being done to cut short the death, and also maybe we don't have the evidence that how many hours they waited for that one to happen.
Okay.
We'll look into
Thank
the
you.
details, brother. As we are looking into the detail, we'll
Sure,
try
doctor.
to find answer for that.
Thank you. If there are any questions, we will wait. Otherwise, we will have to conclude the program. I think there are no more questions. I think.
Hello.
Yes,
Good
please.
evening. Good evening, from Perambur.
Yes, brother.
Churches are following the Good Friday services 11 to 3 o'clock. You're saying that the crucifixion also happening at the same time. That same time is happening, the crucifixion process. As we following the Good Friday services, there any link? No, the churches are following the Good Friday services, the 11 to 3 o'clock. The crucifixion also happening the same. You're saying that 12 noon to 3 p.m. Is there any link that happening the same following the crucifixion time and the Good
Yeah, as I
Friday
told you that crucifixion, that process, that nailing, raising, then putting in everything, that happens in 3 hours. And he was actually in the cross saying that lines for 3 hours. So 12 to 3. By 3 he died. So because of that, for this one, so there is evidence. There are evidences. So because of that, the tradition people are following 12 to 3.
Okay, thank you.
Yes, brother.
Okay, if there are no more questions, then we will have to conclude this program. I take this time to thank the Almighty God who has brought us together for this wonderful session. The session was personally enriching and empowering, very refreshing and very informative as well. To me personally, I think all of you would have benefited through this program. I really thank God for giving us this beautiful opportunity. I also take this time to thank our dear Dr. Pethuru Devadason. Doctor, we see a lot of work, what you have put in. You have toiled yourself a lot to bring out all these things to enlighten us. Thank you, Doctor, from bottom of our hearts that you have brought this wonderful presentation. I also thank all the participants today who have come forward. Most of you are from Bible Reading Challenges. I see that. I really thank you all for taking part in today's session.
Thanks for watching. Like, share and subscribe GODependence YouTube channel.